Hello everyone. So today let's learn about the bundle of 5 for postpartum hemorrhage. Okay. So what is PPH? It is a excessive bleeding after childbirth. If it is a vaginal delivery, then if the blood loss is more or equal to 500 ml, then it is called PPH. If it is a C-section and the blood loss is more than or equal to 1000 ml, then it is called PPH. In detail about PPH, I have made a video, and if you want to learn, you can check them out. Okay. So now let's learn about what are the causes of PPH. This is very important. So you need to, if there is a bleeding after the delivery, you need to rule out 4 T's. Okay. So what are 4 T's? Tone, tissue, trauma, and thrombin. Okay. So tone is the uterus has to be, after the delivery, the uterus has to be hard and solid. Okay. But if the uterus is flabby, there are chances that there will be a bleeding. Okay. And the most common bleeding, it is due to atonic uterus. Okay. And tissue, here tissue means if there is a retained placenta or any placental fragment has been retained in the uterus, that also can cause bleeding. Okay. And trauma means if there is any tear or injury in a cervix, vagina, or even uterus, that also can cause bleeding. So you need to rule out that as well. Okay. And then thrombing means if there is a blood disorder, that is a coagulation disorder. Okay, that you need to rule out. Okay. So the care of bundle is a small set of evidence, okay, evidence-based intervention that when performed together and promptly, it significantly improves the outcome. So now what are the goals of bundle of 5? First is to stop the bleeding rapidly. Second is to maintain circulation, and then the third is to save the mother's life. So the first is restoration of uterine contraction and compress bleeding vessel immediately. So if you are if you found out that the mother is bleeding and you are there in the ward or in a labor room, your job is first, it should be you need to call for help, and your second is you have to make sure that you stop the bleeding. Okay, that can be temporary. Okay, manually you have to stop the bleeding. And then second is the goal is to maintain circulation, is to restore the blood volume. So that is what I said, you have to, if you have stop the bleeding, it will restore the blood volume, prevent shock, and preserve organ perfusion. Okay. And then you can save the mother's life by reducing the need of hysterectomy and lower the maternal mortality. So now what are the 5 bundles? First, step 1 and step 2, let's learn. First is call for help. You have to activate emergency obstetric team. If you have a team in your hospital, you need to call them. And if you don't, but in a hospital you should have, but if you don't have, you need to call your staffs. Okay, immediately. And then because this is something that, this emergency is something that you cannot manage it all by yourself, so you have to call for help. Okay. And number 2, the step 2 is to do a uterine massage. If it is as we talked about it, that the majority or the main cause of the bleeding is usually uterine atonic uterus. Okay. So what you need to do, the second step is to massage the uterus, or you can do bimanual compression. Okay. Massage the fundus uterus in a circular motion until firm. A contracted uterus acts as a natural clamp or on the maternal blood vessel. So assess the tone, fundal height, bleeding, and then vitals should be continuously monitored. That is step number 2. So now let's learn about this step number 3, which is, now here you use uterotonic drugs. Okay, the drug of choice is, first is oxytocin. Okay, so 10 unit of oxytocin should be given IM. This is during your active management of third stage of labor. If you have given good, but after that you have to give 20 units of oxytocin in 200 ml of IV, which can be either NS or RL. Okay, so while when you don't if you don't have a 200 ml of fluid, then what you need to do is you need to give in 1000 ml. But here in 1000 ml, how do you give? You have to give 10 units of oxytocin in 1000 ml and the other 10 unit in the another 1000 unit 10 unit in 1000 ml. Okay, so together the total dose is 20 unit. And if oxytocin could not stop the bleeding, then you can give methergine. Before giving methergine, make sure that the mother doesn't have a blood pressure or she should not be severely anemic. That means hemoglobin should not be less than or equal to 7. Okay, and then if methergine is could not control the blood bleeding, then you can switch to carbopost. Carbopost also make sure that the mother is not having asthma problem. Okay, and then you can also use misoprostol. So now step number 4, which is IV fluid and blood replacement. So first what you need to do is you need to insert IV cannula which should be of 16 or 18 number. This is usually in green and gray color. Okay, and because this has a large bore. Number 2, you should start rapid IV fluid. Okay, either normal saline or Ringal lactate. Here when you start the IV fluid, you should also give the oxytocin. Okay, the 20 unit 1 oxytocin you have to give. And then send the blood for CBC, grouping cross match and coagulation profile. Okay, and arrange for transfusion and insert Follis catheter. Okay, the urine output target should be 30 ml per hour. Okay, so as a nurse, what you need to monitor? You need to monitor BP, pulse, SpO2 and urine output. Okay, and then after that, make sure you avoid excessive crystalloid once blood products are available. So now step number 5 is use of tranexamic acid. Okay, so what it does is it helps in preventing breakdown of a blood clot, and it stabilizes the hemostasis during the severe bleeding. So what is the dose? It is 1 gram IV over 10 minutes. So that is why use infusion pumps set a timing of 10 minutes. You cannot give tranexamic acid rapidly. Okay, and if the bleeding continues even after 30 minutes or restart within 24 hours, you can give the second dose, same as the first one, 1 gram IV. Okay, now here remember, this is very important, listen carefully. Tranexamic acid should be given within 3 hours of birth. It should be given 3 hours of birth. This is the indication. So this drug should be used when within 3 hours of birth. Okay. Okay, so now supportive care and documentation. You have to estimate the blood loss. Okay, and here the estimation should be you have to weigh the pad. It should be quantified. Okay, so here if it is 1 gram, if the pad weighs 1 gram, that means it is 1 ml. If the pad weighs 500 gram, so it means 500 ml of loss of blood. Okay, so if it weighs 1000 gram, then it is 1000 ml of blood loss. Okay, visual estimation should not be considered. Okay, number 2, it is administration of oxygen. If a mother is having difficulty in breathing, then you need to give a mother a mask and administer oxygen. Okay, and how much it should be? It should be 10 to 15 liter per minute. Okay, and keep the patient warm. So if there is a bleeding, naturally what happens, there is a dip in temperature, body temperature also, so she might feel cold. So use of blanket or warm fluid is something that you need to consider. Okay, and reassure and document. Okay, record time of the PPH when it happened. Okay, and blood loss, how much is the blood loss, vitals, drugs, fluids and respond to the treatment, whether it is responding to the treatment or not. That also should be documented. So last but not the least, so what are the key takeaways? So first is do's is recognize PPH early, act immediately, perform all the 5 steps simultaneously, quantify blood loss, monitor vitals frequently, and document everything. Okay, so what you should not do is don't delay for lab report. Okay, don't wait for lab report. You have to act. Don't skip the 4T assessment. You have to rule out what is the cause of a bleeding. Don't give uterotonics without checking the contraindication. Okay, so don't leave the patient unattended. Okay, so also remember that bundle of 5 is a coordinated package. Okay, not 5 isolated steps that you have to do first this, second this one, and third and this one. It is not like that. It is a coordinated package. So nurses plays a central role in recognition, initiation, monitoring, and team coordination. So in PPH we always say every minute counts. Okay, thank you so much everyone. If you like it, please share and subscribe.